are we using?
10 by 12.
Length or crosswise? Lengthwise, okay. In the table, Bucky, correct?
Yep.
Mm-hmm.
So are we using a grid?
Yes.
Yes.
Essentially, yes.
Okay, essentially, yes. Okay. For the AP knee and the knee projections for simulations, we are going to assume that every patient is an average size patient. So average size typically includes a grid, so parts over 10 centimeters. Okay, but for the AP, that means that we are not angling our CR. Okay, we talked in class today about different ways to angle the CR for different body habitus. For simulation purposes, everybody's of average body habitus, so no angle. Okay, so we're gonna line up, get our IR and detent. What's my SID? 40. Okay. Jaina, I think I'm gonna have to move the table. Okay, so, Emily. All right, I'm gonna have you scoot over away from me just a little bit more if you can. Away, just a little bit more. There you go. Okay, so where are we centering for the AP knee?
Half an inch below the apex.
And remember, the apex is that inferior angled portion of it. So we're gonna feel for her patella. Here's the apex. I'm gonna use about 2 fingers, so I'm gonna go there. And then midway on the knee, right? So midway between the lateral and the medial border. Okay. And we want the leg to be internally rotated how much?
45.
Wait,
We're at
sorry.
3 to 5 degrees. 3 to 5.
Thanks, Emily.
3 to 5 degrees, okay? We want to rotate in just a tiny bit. We want this patella to sit right in between the lateral and the medial border of this. So if we put our hands here, put our thumbs down, the patella should be equal distance from each side. Okay?
We're centered half inch distal from the apex of the patella.
Lined up our CR and our IR. I'm gonna drop my SID now that I put my Bucky in. Okay, collimate side to side to include the soft tissue, and your marker should be on the lateral side. Okay, it is okay to put your marker on the table, especially with using digital equipment. A lot of you can't put your marker on the Bucky, on the IR. So we can put it on the table, just never on the patient. Okay, so once we shield her for this, what are her breathing instructions? We just ask her to hold still. Okay, so that's the AP. Any questions there? Okay, so external rotation. Where are we centering for this one?
Midway down the leg, a half inch below the patella.
Yes, so half an inch below the apex of the patella. So apex of the patella is here. I'm gonna scoot down just a little bit. And we need to externally rotate how much?
45 to 47 degrees.
45 degrees. So we are gonna have her move her entire leg. And yes, that means that she may need to roll up onto the affected side hip a little bit. Okay, don't let your patient either roll just their leg or roll just their hip. Some people even try to just roll their foot. Okay, their whole leg has to come out. And we are going to roll until these condyles of the distal femur are 45 degrees to the table. Okay. Okay, so now again, we're going to center midway between this lateral and medial portion of the leg, half an inch below this apex of the patella. So at this level here, and then along the long axis of the leg. We're going to put our right marker in here again on the lateral side. We've shielded her. What are her instructions? Hold still. Okay, so let's quickly go to the internal. Okay, the internal rotation is exactly the same setup, only this time we're rolling them all the way
45 degrees.
internally 45 degrees. And if you can see how Emily's laying, she's rotated her whole body. Okay, and I'm actually going to bring her back just a little bit because she was able to rotate further than 45 degrees. So these epicondyles are 45 degrees from the table, Bucky, or the table. We are going to find the apex of that patella again. We're going to center a little half an inch below the apex of that patella. and midway between the medial and lateral borders again. Okay, we still have that
Perpendicular CR.
still have a 40-inch SID. We still are lined up with our tube, and our tube is still lined up with our bucky. Patient is still shielded, and then her instructions are to hold still. Okay. Okay, so we are going to angle 5 to 7 degrees cephalic. We've adjusted our SID down to 39. I'm going to go 6 because that's where it's landing. And we're centering, where did we say?
1 inch distal to the medial
1 inch.
condyle.
1 inch distal to the medial condyle. I'm going to line up my tube and bucky now. Because I angled, I changed things. Okay, we've got Emily up on her affected side. Okay, we've flexed her knee about 20 degrees. And we've rotated her until her condyles and her patella are perpendicular to the IR. And now we're going to find that medial condyle, which is right here. We're going to center 1 inch below it. Ooh, I'm not a table. So I'm going to have her scoot over just a tiny bit. Be careful because you're on the edge over there. Okay? Watch your fingers too for me. Thank you. Okay, so 1 inch inferior from this medial epicondyle. We've got patella here perpendicular still. We're looking at the shadow to make sure we include that. And we're going to center midway between the anterior and the posterior portion of the knee. So I'm going to come back just a tiny bit so that we do have light behind her knee here. We've got light on her calf muscle. We've still got about half an inch of light past her patella here. We're going to put the marker in here. Okay. Anterior, always on your extremities. And she's shielded. And then what are her instructions here?
Hold still.
Hold still.